Hey guys, and welcome back to the show. I am your host, Megan Hardy, and I am joined today by a very special guest, Dr. Kelsey Shumway. Did I pronounce it correctly? Shumway?
Shumway, but it's close
Shumway. Oh,
enough.
we're so close. Dr. Kelsey Shumway, who is a physical therapist and owner of Shift Physical Therapy in St. George, Utah. And Kelsey specializes in orthopedic therapy, women's health, and pelvic floor physical therapy, which is what we will be talking all about today on this episode. And she uses a very fitness forward approach to help you return to the activities you love or begin your journey towards a lifestyle change. And Kelsey's big thing is she's passionate about meeting clients wherever they are and where they're starting on their health and fitness journey and then empowering them to reach their goals. So, Kelsey, welcome to the show.
Hey, thanks for having me. I'm so excited to be here.
Yay! I'm so excited to have you. We were just talking before recording, and I'm like, I'm so pumped to have this conversation right now.
Yes, so many good conversations are about to take place.
Yeah. And so I actually went to see Dr. Kelsey in my second trimester. And I'll go and share with everyone here too. But I went to see her and I was planning to go back for more visits during third trimester. But little did we know that I would be having my baby at 26 weeks and 2 days. So little Ryder is here in the world now. But Kelsey and I had a really awesome conversation around pelvic floor health and therapy. And I was like, oh my gosh, I have to have her on the show. So she's here today and I'm so pumped to have you. Would you just share with everyone like a little bit more about you or like how you got into physical therapy and those like specialties in particular?
Yeah, I feel like I'm like the very normal case of I got injured in high school playing sports and I ended up in physical therapy, which is where I always wanted to go, as I wanted to actually do a lot of sports rehab. And then I ended up getting into PT school. I graduated, and my first job, I was working in like a general outpatient clinic, and I had a pelvic PT that was working with me. And a lot of times I started getting women, specifically postpartum women, that were having a lot of like back pain and hip pain. It was more like orthopedic pain, so that's why they're on my schedule. But as I was working with them, I started to realize that this wasn't what I was taught in school, and some of their pain just wasn't adding up. So I
Mm,
started to collaborate with the pelvic floor physical therapist that I worked with. And I started to realize really quick that I had a big gap in knowledge, that if I wanted to treat people fully, I needed to understand the pelvic floor.
mm,
So that's when I started to kind of branch into pelvic floor a little bit. And then I feel like once I started to dip my toe in it, I kind of just fell face first into it. I feel like pelvic floor contributes to so many things we don't talk about. And especially for us women, I feel like it is such a underserved population. And it's just at some point in our lives, we're going to be dealing with our pelvic floor. And it just contributes to so much more than I ever thought. So
mm.
I ended up just kind of falling down that rabbit hole, and I've been here ever since.
I've been here ever since. I love it.
Yeah.
And you're so right. Like through it's like everyone's gonna deal with something pelvic floor related, especially as a woman, like between pregnancy, postpartum, perimenopause, menopause. Like
Yes, it is just a continuum. And it's even crazier. I have some patients that are like they're teenagers or kids, like, it doesn't even have to be until you have children. Like you can have literally pelvic floor stuff anywhere along that timeline.
oh, that's so needed, and I'm so glad you're filling that gap. It's so good. So good. Well, I would love to just kind of jump in. We have some questions and topics. So I actually put a poll out on my Instagrams and I think maybe Facebook too. But anyway, Instagram stories asking, hey, I'm having Dr. Kelsey on the show. What do you guys want to know? And I got a bunch of feedback and questions. So I'm kind of just like go through those and we can kind of do it like Q&A
Yeah, let's
style.
do it.
Yeah. So first question was, is there a way to assess how weak your pelvic floor is during pregnancy?
Yes and no. I teach people how they can do this for themselves. I always tell people my own experience. The first time I went to a pelvic floor class, you have no idea what you're feeling. And so I'll tell people like how you can do this for yourself, but I highly recommend having a pelvic floor physical therapist assess you, just because you've never felt a pelvic floor and you don't really know what you're looking for. But in order to like probably get the best assessment of the strength of your pelvic floor is probably doing an intravaginal assessment. And how we do an assessment is we use a glove lubricated finger to go in vaginally. And we're looking for a few things as you're contracting. We're looking to make sure that all of the walls are contracting. Like, are we getting that squeeze? And then are we also getting a lift? So we have these
Mm,
different like scales that we measure strength on. Like 0 means there's no contraction, and 5 is all the walls are contracting and there's a strong lift, like our fingers being pulled inside. So this is something you could technically do for yourself if you inserted a glove lubricated finger, or just make sure your finger is clean. And then looking to feel if you can feel the muscles contract. If they're all contracting, if you feel all the walls contracting, that's really good. Also, we should feel like your fingers being pulled up inside. Now, a lot of times during pregnancy, it's actually sometimes harder to like let the pelvic floor go. And so I always look for two. Not only can they like contract and they have all that strength, can you also feel those muscles like let go when you tell them to let go, or do they still stay
mm.
like nice and tense? So it is a way you can do it. If you're not sure, get someone who's done it. Like I remember the first couple exams I did during my class. I'm like, I don't know what I'm feeling. Like I don't know what's happening. I only
Yes.
imagine doing it to myself. I don't think I would know.
I will say I did not know, and especially as someone in the fitness space and like very in tune with my body. That's what people keep saying to me after like having Ryder early and recognizing the short story being that I didn't feel his movements, and I'm very in tune with my body. And when I came to visit you, I ended like growing up dancing and very aware of my pelvic floor. It's just different, and like I wouldn't have known what I was should be feeling for if I were to do
Yeah,
it
I don't
myself.
think
Like,
we're taught. Like,
yeah.
especially for you, like you come from a background that yes, you more than most people have thought about your pelvic floor. A lot of people have never even thought about it. But it's hard. It's hard to assess the strength of it. It's not like a bicep curl where you're like, I can do this much weight. Like you just don't have that as much objective measure.
Yes, yes. And I'm glad. It was funny when we met the first time, because I'm like so used to like with all my OB visits and pregnancy visits and stuff, but I was like I didn't actually know what that exam entailed. So I think that's helpful for people to know when you go to visit. It's like that's actually one of the best ways, right, to examine your pelvic floor is to do the intravaginal
Yeah,
exam, right?
I honestly, this is funny. When I first got into pelvic floor, I remember being like, I want to be a pelvic PT, but I don't know if I want to do that. But it just gives us the most information. Like we have ways to assess externally, but honestly, it is not the best. And we're taking our best guess, and I don't like guessing. So for me, I'm like, if I can know something, let me figure it out. Like, don't let me just guess at my, what I think is going on.
Yes. Oh, so good. And when that's actually part of the reason I came to see you in second trimester was like proactively, I wanted to like, I knew third trimester would be where we would really start to kind of change some things up in preparation for labor and delivery. But I was like, I wanted to assess what my pelvic floor was where it was currently to have that baseline for postpartum too. Cause I was like, I don't know. And if anything, I thought maybe I leaned more towards the too tight side of things just from,
Right.
lifting heavy and fitness and whatever. I was like,
Yes.
I was like, I want to set myself up well to not be like working against my body in labor, you
Right.
know?
You
So
like want to have, it's like walking a balance beam. You want to have the strength and control, but then when it comes to labor and delivery, you need that mobility and you need that control to be able to actually lengthen your muscles versus, keeping them tight all the time.
yes. And I think we found that you said like I was on the kind of on the a little bit tighter scale,
Yeah, you're like,
but
I always like it's a scale. Like we have people that cannot let go of their pelvic floor. They are really tight, really overactive. And then you have people on this end that are like, can't contract it, no strength. And you just fall more towards that tighter end. And it happens a lot with people who are more active, people who are into weightlifting, with your background of dancing, gymnastics, things like that. People tend to fall more into that overactive bucket. And it's more they need that control and that lengthening of their pelvic floor so they can use the muscle through emotion versus just like keeping it clenched and not being able to actually use the muscle.
well, and I would love to ask you like what your for after our visit, like what was your advice to me with when we had this conversation? This is what kind of sparked our um our like intrigue in having a podcast episode about this because we were both, I don't know, I was geeking out. I was like, oh yes, Dr. Kelsey, thank you for
I will
saying
geek
this.
out every time.
Because, I was asking kind of as far as like working out or strength training, like what her recommendations, your recommendations as a pelvic floor PT. I was like, as far as working out, like, are there things you think I should back off of or whatnot? And I'm just, if you could kind of share a little bit about what your advice to me was and like
Yeah.
your kind of perspective on it.
Yeah, this is a kind of a blanket statement that I will say for most people is we want to maintain your strength as long as we can throughout pregnancy. A lot of times I think people get caught up in the, especially with the pelvic floor, is that overactive and you're fighting against yourself. But maintaining global strength, your core, your hips, your pelvic floor, maintaining that strength throughout pregnancy, I think is one of the best things we can do, hands down, for our body, for baby, for pelvic floor. I don't think straying away from getting stronger is ever a good idea, especially during pregnancy, because we're like an uphill battle with hormones
Mm,
and things changing. Like our body is getting weaker, our core is getting weaker. And one of the best things that we can do just across the board is maintaining that strength.
so good. So good. And not what a lot of people have heard or been told for sure.
Right. I think a lot of times, and I think a lot of it, the advice was always based on fear. We kind of talked about that, you want to protect baby and protect you and, not cause diastasis. And the more, that research is coming out, it's no, exercise is protective. Exercise is protective against, having these problems that we all thought that laying in bed was going to help. So, I think it's cool. We'll keep seeing more research come out, but I think at the end of the day, keeping that strength and maintaining strength is one of the best things we can do.
So good. So good. And like you mentioned before we start recording, it's like there, if you have certain contraindications for certain working out or methods, then yeah, sure. But like it's not a hard like blanket statement for women to not work out or not.
Right. Unless you've had conversations with your OBGYN, like there are certain things that people shouldn't be working out with, certain things with the pregnancy if you're high risk and things like that. And of course, those are guidelines that we need to follow. But for the average person with a healthy pregnancy, they're not on contraindications or bed rest. We know the literature is actually it's pretty clear that we should be doing strength training. We should be doing these things for our body, and it's not only good for us, but it's good for the baby.
Oh, so good. So good. Well, and kind of transitioning to one of our next questions, someone asked about C-sections and pelvic floor pain. And
Mhm.
I think traditionally we think of just like vaginal delivery and pelvic floor pain. So
Right.
if you could kind of speak to that some, and if there's any differences that you've seen. And then speaking from my experience, I went in for an emergency C-section. So I'm like, I haven't noticed pelvic floor difficulties at this point. But curious, like what you've kind of seen as far as like C-section versus vaginal births and pelvic floor pain.
Yeah, I think there is a pretty big misconception. Like, I'll have people all the time that'll come in after having a C-section. They're like, "Oh, I had a C-section. You protected my pelvic floor." Which to some degree, yes, like you didn't have that mechanical stress. The pelvic floor wasn't overstretched. Like you didn't have those same things. But I always like to remind people you were still pregnant. You still carried your baby. Your pelvis still widened. Like you still actually had some of the, stress on your pelvis. You just didn't have the mechanical stress of pushing the baby out. So there's a lot of things that can come up with C-sections that I think are, it can be similar to vaginal delivery. Like you can still have urinary incontinence and these problems, even if you have a C-section, like depending what mode of delivery you have, like obviously the statistics are higher for some diagnoses. But it's not protective of everything. So you can still have pelvic floor pain that can be, either contributing from like scar tissue. You can also have like nerve dysfunction. So they're cutting through different layers, and it's not uncommon to actually develop pelvic pain because of the nerve. So we can have, nerve irritation. And we still have postural changes that occur from
Mhm.
pregnancy and the core changes. Your core still was, stretched out for 9 months or however long. That does impact the pelvic floor. The core and pelvic floor work together as a system. So I think looking at it more globally than, yeah, with a vaginal delivery, you have that mechanical thing that happens, but with a C-section, you still had everything else of being pregnant. And then now we have, issues with scar tissue or engaging your core and maybe nerve irritation that can be on board too.
Oh man, I'm like, oh, ding, ding, ding. That's like ringing all my bells right now after my C-section because I'm like, I still have like can't feel anything, like super numb down there. And like they're like, it can take 6 months for the nerves, to come on back. And I'm like, and I could totally imagine and see that happening where it's like that's going to throw off or could cause other pelvic floor things to be thrown off.
Yeah, for
For
sure.
sure.
And I see you can see weird things with it too. Like sometimes I've had a few patients in the past when they got pregnant again, they ended up having like upper abdominal pain or back pain, but it was all stemming from that C-section scar. So it was like the scar was being stretched out, it was being like tugged on. So you can start to see it in other things too. It doesn't have to be right away. It can be with recurring pregnancies, but they just present their own issues or different problems. And there still can be some carryover. Like you can still have, like I said, urinary incontinence or not as likely to have prolapse, but people still could, just the changes that happen during pregnancy.
Yeah, yeah. And do you give is your kind of like advice different for like someone who's had a vaginal delivery versus C-section, or is it really just dependent on the patient, of course, but like is there very different directive or advice that you give?
Yeah, I
Yeah.
feel like there's different foundations. So definitely with C-section, regaining core strength and that scar tissue mobility tends to be up a little bit higher on the docket. And like with a vaginal delivery, core, like still we want to restore the core, but it might not be as much of an emphasis. It might be the core and pelvic floor together.
Mm,
And the early postpartum things will be different too. Like, obviously, with a C-section, like you're not going to be able to do as much quickly because you're recovering from a major abdominal surgery. So I think that
hmm.
early on, there's a lot of different changes. As you get further out from that delivery, it might start to look the same, but it really just depends. Like everyone's different. Like some people can have, a vaginal delivery and you would never even know. And the same with the C-section. So everyone presents a little bit different. So I think at the core, there's some different foundations that we want to make sure that that person can do. But at the end of the day, it's making sure that our muscles are strong and that they're working how we need them to.
So good. And then how often are you, or how soon after postpartum are you seeing patients? Like if, whether it's C-section or pelvic floor, like how soon are you like, hey, let's come in for like to actually start assessing and addressing some of those things?
I usually tell people we can see them as early as 2 weeks postpartum, and it
Oh,
just
wow.
depends on what people's goals are. So I
Okay.
am actually a big believer of starting your rehab process early. Like a lot of times, we hear that, oh, I can't do anything. I haven't been cleared for exercise.
I was just told that today.
Yeah, and
Yeah.
it's not based on anything. So it's actually interesting. We have research where people like they measure the force of like picking up their baby or picking up 10 pounds. And we know that that exerts more pressure and stuff on the pelvic floor than doing like a bridge or a clamshell. So I think that like there's warrant to like, hey, like your body's healing, but there's also time when we can start to rebuild and we should start to rebuild. We need to make that connection to our core and pelvic floor. We can start to work on that hip strength and just kind of reconnect with our body. But I also tell
So
people
good.
it's also an individual journey. Like some people, their world is rocked in 2 weeks. They're not ready to be out in public. They're not ready to exercise. They're just surviving. So
Yep.
my always for every patient is, hey, I can see you as early as 2 weeks when you feel ready. And guess what? If you're not ready until 6, 8 months postpartum, that's okay. Like it doesn't
Yep.
matter how postpartum you are, you can still be seen and you can still get help.
Oh, Dr. Kelsey is such an individualized approach. I love it. That's what I'm like. I feel like it's so much easier to say blanket statements. Like it's just, and to cover your CYA, right? Like cover yourself and then also even in the like nutrition and fitness space, like people want rules where it's just like don't eat that. Only
Yes,
eat
in
this.
black and
Like
white.
black and white. And that's where it's not like it's gray and that's where the individualization comes in. So I so appreciate your
Yeah.
approach to that.
Yep, I think everything kind of falls in that messy middle somewhere.
Yep. Yep. I'm like, I know it's an annoying answer, but it really depends.
I
It's
know
always,
that
it depends.
that's the one thing I remember on the first day of PT school. I remember they said that like you're gonna say it depends way more often than you've ever thought, and it's true. Like
Yeah.
we don't know what's best for every single person. Like there's just not. Like we can have general statements, but it should be dependent on the person and their goals and what they're trying to achieve.
Amen. So good. So good. Well, I would love if we could transition a little bit to, kind of from the pregnancy and pelvic floor space to who a lot of the women who listen to this podcast are probably starting to go into the perimenopause, menopause stage of life as well. We
Mhm.
kind of have a nice wide range of the postpartum ladies and perimenopause ladies. And someone asked about pelvic floor health in postmenopausal women. So if we could kind of start there and just any overall like what you see and like overall like kind of advice or tips you maybe would give like a postmenopausal woman for her pelvic floor.
Yeah, I actually find that postmenopause or even perimenopause, a lot of pelvic floor symptoms start to show up. And it has a lot to do with that decreasing estrogen. So, our vaginal tissues, urethral tissues, they heavily are being contributed by that estrogen. And we start to see atrophy. So, we start to see like tissue atrophy as we start to go through menopause.
Mm,
And it can play a huge role in all of those symptoms. I feel like things have like really started to shift in the last little bit. It's actually becoming more common or standard that healthcare providers are starting to get women on topical estrogens versus,
mm,
15 years ago, everyone was afraid of breast cancer if you had, history of it. So a lot of times they were actually denying or not having women go on oral estrogen. But now we're starting to see a bigger shift towards, most people are okay to be on a topical estrogen, and that can really, really help maintain strength. And I find
mm,
with people, not everyone wants to be on hormone replacement, but it can be really, really helpful to help maintain the integrity of the muscle and decrease atrophy. But even for the people who don't want to, those muscles they're atrophying is what's happening. And so we might have to work a little overtime to try and maintain what strength we can. So both like urethral tissues, vaginal tissues, and pelvic floor muscles. It's actually a really good time to get in and to make sure that you know how to move your pelvic floor and you know how to use it, and the sooner you can stop some of that atrophy from occurring is great. But there's also some good studies too that even people who have been through menopause 15, 20 years still do good with strengthening. It just it's a little bit harder, but there's still so much that you can do, and like prolapse and UTIs and all these things that are so common with
mm.
menopause. There are things that can be worked on, and I find that there's a lot of good synergy between pelvic health and pelvic floor physical therapy in the medical field, and just kind of bringing all those together.
Oh, so good. And are you, because I know you have a very like health and fitness forward approach to your PT practice, like, or as a part of that, so you recommended like estrogen, topical estrogen, or like even hormone replacement therapy can come in and be helpful for some women. And then also, what about like in the nutrition or like PT or training space,
Yeah.
kind of recommendations?
So especially you probably know this from nutrition. I don't think women get enough protein. They'll be all. We don't. And especially it's something that I see a lot more common in women that are going through perimenopause and menopause, that we are not getting enough protein. And if we do not have enough protein, we're not going to be able to build muscle or maintain muscle. So
Yep.
I actually think nutrition is just as important. If we're not getting the things we need from our diet, it's harder for our body to support ourselves. So making sure that we have that in play, actually, I think probably is more important than the exercise that we're going to be doing
Mm,
if we don't have the nutrition in place. So yes, hormone replacement stuff is great, but
mm.
you got to dial in on that nutrition first, and then, maintaining that strength or getting stronger absolutely is the way to go, but you got to have that nutrition dialed in.
So good. So good. I'm like, yeah, that thing, it still applies here, just the same way as someone who just has aesthetic goals or wants to build muscle. I'm like, you could do everything right in the gym. And if you're not supporting it nutritionally, like, you're not going to see the results you want. Same for your pelvic floor, it sounds
Absolutely,
like.
which people don't think about that because it's not like your biceps, it's not like your quads, not these big muscles, but the same thing applies. If we do not have the basic building blocks to build muscle, we can't do as much. So if we can at least hit those protein goals, I think that makes the world of difference. And that's honestly, I have this conversation a lot with some of my patients that they don't want to be on like hormone replacement. It's okay. We got to dial in the things that we can, and you've got to hit your protein. Like eating 30 grams of protein a day is just not going to cut it. So you got to dial in on that first, and then let's see where we can go with strength.
Yes. So good. I was actually just having this conversation with my mom who she came to visit me in the NICU and to stay with us for a little bit and help out. She
Yeah.
goes by Mimi, so instead of grandma. So
Oh, I
Mimi is in
love
town
that.
to help. Yeah. But she was like, gave me some of her, I think it was like a tuna salad or something. And like she gave me her portion and like she's like, you need it. You need the protein and for is postpartum, whatever. And I was like, scooting it back to her. I'm like, so do you postmenopausal. Like
Right back at you.
right back at you. I'm like, you need the protein too. So
I love
anyway.
it.
Yeah. But also along those lines, with the postmenopausal or menopausal woman, like what are some things that they could be doing? This was a big question. I think probably the majority asked for a loose pelvic floor. Like what are some things they could be doing to help with that?
So I find like a loose pelvic floor or a weak pelvic floor, actually general strength training, like we know that getting stronger globally is going to be helpful. So yes,
Mm,
we do specific pelvic floor work. We can make sure that we have everything dialed in, that we have the coordination. We're using our pelvic floor when we're bracing our core. We're using our pelvic floor when we're lifting. So we can dial all of that in, but also making sure we have the hip strength, the core strength, the back strength. That also they're all synergistic. Our muscles don't work together in isolation. So
mm,
making sure that we globally have strength everywhere is great, but then we can also do specific pelvic floor work. And that might look like, doing dead bugs or bird dogs or things where we're using our pelvic floor. And it might look like strength training. We might be doing step ups and squats or plyometrics. Our pelvic floor is also a reflexive muscle, which people don't think about. They just think of the Kegel.
mm,
But when we're jumping and doing things, our pelvic floor is reflexive and it should have like a descent and a contraction. So
mm,
training the pelvic floor in many different ways, like plyometrics, is actually really, really good too, and ways that people don't think about. Most people think about just doing Kegels, which Kegels are fine, but not usually the end all be all. It's not, it's teaching you how to use a muscle in isolation when we should be using all of our muscles. So global strength training again will probably be my answer for everything.
but yeah. But I think that to your point, not many people think about like when they're thinking pelvic floor health or strengthening it or whatever, they are just thinking about Kegels or pelvic floor specific exercises. But
Mhm.
to your point, your body is works synergistically, and when you're strengthening other muscles, it's going to help your overall, the global effort for your pelvic
Wow.
floor. So that's
I
so
wish
good.
I had a model, and there's something that people don't even understand, but there's a hip muscle, your obturator internus, which your pelvic floor has fascial connections, or it attaches via this ligament called the ATLA. There's such big synergies between the pelvic floor and the hip. So if we don't have hip strength or our hips aren't doing what they're supposed to, then our pelvic floor is not doing what it's supposed to. So hips do play a huge role, like having that strength and that stability, even though it's not the pelvic floor, they work together. So hip strengthening also is very, very good for the pelvic floor.
So good. Yes, I'm actually just from being like post surgery, I'm like, oh my gosh, I feel like my glute and hip strength just from like barely standing up out of chairs and like barely, I'm like, I can feel it waning or again, and
Wow.
I'm like, oh my gosh, we're only like 14 days out from this at the time of recording this right now. But,
Right.
I'm like, that's one of those things I'm like, I know I need to get back into as I can,
Right.
and even supportively for my pelvic floor too.
Right.
And as like you said, what a lot of people don't think about with strength training is like when you're doing compound lifts or you're doing anything where you're bracing your core, you're also can be engaging your pelvic floor to
Right.
strengthen. So that's so good. Okay, so strength training is pretty much the answer for everything.
I'll try and have another answer
Yeah.
next.
Oh, that's so good. And then another question was, I think this kind of goes along with our topic right now, but someone said they're getting older and leaking urine.
Mhm.
Do Kegels really work? And they said, I have not noticed a difference. And someone else, a different person said, Kegels are not enough. I need to know. I feel like that's kind of in the same vein, but if you would add anything to that.
Agree with that. Like, don't get me wrong. Kegels are an essential part. It is just a contraction. It is a muscle contraction at the end of the day. So it's important, but it's not the end all be all. Especially as we're talking about incontinence, there's so many more reasons why we can be leaking other than just that we're weak. So Kegels are a foundation, and I think they're important. I think on the internet you'll also see people like people will fight all day long, like don't do Kegels, Kegels, like it's
Yes.
just like back and forth. And I'm like, at the end of the day, it's somewhere in the middle. It's a foundational movement. No, if Kegels worked for everyone, I wouldn't have a job.
Yeah.
So I think it's a foundation, it's a movement. But there's so much more that we can do. There's so much more that your body needs than just that squeeze and that lift. So yes, not enough for most people. Some people they do. Some people are like, I just do my Kegels and I'm fine. I'm great. That's all you need. But at the end of the day, there's a lot more that you can do than just Kegels.
Yes, and I've seen that narrative online too, where literally you'll see one post or reel or whatever where it's like Kegels, do your Kegels, and the next one is like, no, don't do Kegels. They're gonna ruin you for whatever.
Yeah. And I think there'll always be, I think people like to be like sensational, like so there'll always be that, but it's usually somewhere in the middle.
Yeah, like to be sensational. Yep. Awesome. And I think one of our last questions here, let's see, we have other than Kegels, what can be done for strengthening? So we talked some about that. And then if you would just kind of, if you could just elaborate on this, their comment was they are already doing compound lifts. They said, I'm hoping my compound leg lifts will help improve pelvic floor over time. So maybe if you
Mhm.
could just speak to, I don't know, volume, duration, what you could expect to see with your doing compound lifts or any like warnings, signs, or anything that you would share, kind of just like advice around, strengthening other than Kegels.
Yeah, I think one of the big things, and this is, I feel like I'm probably biased because the people who come see me, they haven't been able to figure it out on their own.
Mm,
But a big part of like using our pelvic floor is that core brace. And a lot of times we're not either bracing our core correctly, we're not bracing our pelvic floor correctly, we're not managing pressure. So like when we're squatting or we're deadlifting, we're bearing down and we don't realize it. So I think
mm,
sometimes it is like we need to make sure we just have that foundation that we know that our pelvic floor is where it needs to be. We also know how to relax it. So I think having that foundation is the start, and then you can tie it into all of those compound exercises. So all of those things will help. And as you're bracing your core and you're moving through it, it will strengthen your pelvic floor. And we know that having that improved strength will also indirectly strengthen the pelvic floor because you're not using your pelvic floor.
mm,
So I think having those foundations, knowing that you're using your pelvic floor, you're letting it go, you're not clenching it all the time is a good foundation. And then making sure we're also tying that into other things. So compound lifts, yes, are really great, but we also need to make sure that we're not lacking in other departments. So like a lot of times what I see with pelvic floor things, the biggest muscles that people are weak in tend to be their pelvic floor, their lateral hips, so their abductors, and then their adductors, their adductors. So sometimes those are just not, whether we're not hitting them with accessories or we're not utilizing them. So making sure that we're not, we don't have asymmetries, that we have adequate, strength in most of our hip muscle groups, I think can be super helpful as well. So I think accessories also play a role if we have a lack of strength. So if we're doing really good in those, then yeah, great. Compounds are probably going to be just fine. But having more specific accessories, if that person needs to, can also make a difference in their pelvic floor. And then lastly, I know I kind of touched on this a little bit, but that pressure management,
mm.
knowing the coordination of what your core and pelvic floor is doing. So being able to lengthen your pelvic floor, being able to not bear down when you're lifting heavy loads, being able to make sure that that core brace and that pelvic floor brace is actually lifting instead of us bearing down into our pelvic floor. I think that can make a world of difference. And I think that's where most people end up like losing that part of the pelvic floor is they're not using their pelvic floor when they're lifting, they're bearing down, they're pushing their pressure down versus lifting their pelvic floor up.
Yeah. Okay. Oh my gosh, so much to unpack right there. I'm like, yes, so much goodness. And I would have to agree with you too. Like, besides getting stronger and just overall compound lifts, I think I often see that the most too, adductors and abductors being very weak points that then affect
Yeah.
everything else too.
Yeah.
What would you? Could you kind of give the two things if you could kind of talk through like verbally, and then I know it's really helpful when you're in person and you can like touch the right areas or do those kind of things, but one, how to lift versus lengthen, And
Mhm.
then also, when you say core bracing, this is like, I feel like the age-old fitness question for every group fitness class. They're like, brace your core, and everyone's like, I don't know how to do that.
Nobody knows how to do that.
Nobody knows how to do it. And you're like, it's actually kind of hard to explain. But if you could you kind of talk us through verbally, as much
Yeah.
as possible, like both of those things?
Yeah. I'm going to share, this is an analogy I like to use that kind of helps it make a little more sense. So, at rest, we want to imagine our pelvic floor is like ground one, we're on level one. When we do a Kegel or we tighten our pelvic floor, we're going up into the attic. We are taking our pelvic floor from our base layer and we are lifting and contracting. So that is like a squeeze and a lift. And I'll share a couple cues that can help with that. And then we also want to be able to go to the basement. So being able to breathe and lengthen down, we need that full range of motion for our pelvic floor. So at rest,
Mm,
we should be able to be on first level, take it up to the attic or take it down to the basement. Now, to take it up to the attic, some of the cues I like to use is like thinking about like an elevator. We're trying to bring the elevator from the first floor to the second floor. You can think about stopping the flow of urine. Some people love the blueberry cue where there's a blueberry on the outside of the vagina and you're trying to pick the blueberry up. It is a squeeze and it's a lift. And then lengthening is when our pelvic floor muscles are actually opening up. It's not bearing down, we're not forcing them down, but we're letting them to like almost like reflexively come down.
mm,
And usually that's done through breathing or positions. So when our knees are above our hips, our pelvic floor gets in a more lengthened position. So think like deep squat,
mm.
will like put a little bit more length through our pelvic floor, but you can also do that with diaphragmatic breathing, like learning to actually let your pelvic floor lengthen just like your belly lengthens forward. So we have to
So
know
good.
that it does those three things. So we have to be, we have our first floor, our attic, and our basement. And then when we
Good.
are talking about a core brace, we kind of want to bring that all together. So I think it gets really confusing. And this is kind of another argument that I think you'll see a lot online. But I think it's more that we don't really have set terms. So in the research,
Mm,
there's so much they'll use the word Valsalva. And then if you look more into that certain research article, they're actually like bearing down or what, like they're not, there's just not cohesiveness of what is a Valsalva, what is a core brace. So at the end of the day, I don't think people are maybe they're misunderstanding, but we just don't have set terms. So even in the research,
yeah.
you have to be careful because you'll read like, oh, Valsalva is going to, cause excessive pressure. But okay, what's their Valsalva? Are they teaching these people to bear down or to like, and when I say bear down, I should clarify, I mean like push down, like you're trying to have a bowel movement, like your pressure in your pelvic floor is pushing down.
Yeah.
So the biggest thing with a core bracelet, and this is something I had to rework. I came from a powerlifting background and I was always taught to push out into my belt and bear down. Like that's how I was taught to brace. So my pressure was doing this forward and down. As I've gotten more into pelvic health, that is not how we should be bracing. So what we should be happening, like even if you are using a belt, which is fine, we're still getting those muscles to contract. So our core
Mm,
should be contracting together. It doesn't mean we're bulging out. It doesn't mean we're sucking in. We are tensioning or tightening those muscles. And then at the same time, our pelvic floor should be lifting. And now, anytime we do anything, like we should have a certain amount of engagement. So like when you go to pick up a 5-pound dumbbell versus a 30-pound dumbbell, you have to recruit so much muscle. And the same
mm.
thing applies for our pelvic floor. We're not always doing a full-on squeeze, lift as hard as I can in the pelvic floor, but our pelvic floor should also be able to reflexively be able to contract enough for the task at hand. But generally speaking, core brace, core is tightening, tensioning. It's not bearing down. It's not pushing out. It's not sucking in. And then we have that pelvic floor lift from the bottom. So we have this good core canister where we have abdomen, pelvic floor, back, diaphragm, and it's all coming together.
Oh, I love that analogy too, thinking of it as a canister, like everything just
Yeah.
locked and loaded,
Locked and loaded.
locked
Yeah.
and loaded, ready to go. No, that's
Yeah.
so good and so helpful. And yeah, those like all of those cues are really helpful. And I know it's a hard thing to explain. I'll post the video to YouTube so you guys can go watch it there if you need to the hand gestures and motions. But you did a great job too of just
Everywhere.
verbally explaining that. Yeah. So good. And actually, one last question or just something I would love for you to share that you shared with me in our initial appointment, going back to the pregnancy conversation was coning. Could you just also share, just as another tidbit or nugget, about like some of the research slash as far as strength training and if you're seeing coning? And then you also shared with me, which was the first time I had heard the difference or like a differentiation of like hard versus soft coning. Could you talk a little bit about that?
Yeah. So I feel like we can get into all the topics of all the fighting online right
I
now.
know, I know. Which
So
they say like to be sensational, it's
hey,
just
here we are.
talk about the hard topics.
I think there is a huge, huge, huge push for diastasis stuff right now. And I think this is the conversation that I'll have with most of my patients is understanding that coning and core separation is normal and you're not causing it. So there's so much things that you'll see online that, oh, you're making your diastasis worse. You caused this. This is not natural. Prevent it. All these like big buzzwords. But what we know, if you get to about 35 weeks gestation, 99% of women are going to have some degree of that separation. And the things that we're being told not to do. So we're being told not to use our core. We're being told to, not do these things. It's actually interesting coming full circle now. We're starting to see that, hey, that being strong in your core is actually probably preventative of it being really bad. So people who
Mm,
have more core strength probably are going to have less degree of separation. So I think it's important to understand that one, we're not causing it. It's natural part of pregnancy. And two, being afraid to use our core, I don't know, research is coming out, but it may not be actually helping us avoiding it. Like that strength is actually important. We need to have strength through our core. And then coming around to
good.
coning, a lot of people are very, very scared of coning that they're making it worse. And one, I think this is what we talked about. There's no research. We don't have research where like you're gonna go and you're gonna cone during your whole exercise and you're not going to. Like we just don't have research to support that coning actually makes the diastasis worse. I always like to tell people like, hey, like if you're coning and you can't control it, you probably don't have the strength or the form or the technique to do that exercise. But that doesn't mean that that exercise blew your core up or, sitting up in bed that you ruined your core. It's just a sign that we can't manage our pressure and that we're probably not strong enough to maintain that pressure in that position. So thinking about that differently, that, you know what, we're probably going to have coning here or there. If we can, engage better or do something different, should we do it? Probably. But again, at the end of the day, we don't have research.
Yeah.
And for some people, they choose to do, I think we talked about this one specifically, they choose to do exercises like pull-ups that they might have coning with. There's starting to be more of a discussion around, is it hard coning or soft coning? So hard coning is the best way I can describe it is it's firm. So when people have the cone, it's firm, it's taut, that pressure is coming out. Soft coning, we're still seeing it. We're still seeing like tissue come out, but it's soft. It's more like, like you might see in someone's abdomen. And what we're looking at is that that's probably okay. And for some people, and actually a lot of my patients postpartum that have really, really wide separations, I have to let them exercise with coning. I make them exercise with coning because in order to help approximate that rectus, we have to use that muscle. And some people, because of that separation, like I have patients that just lift their head up, they just brace their core. They cannot do anything without coning. So
Mm,
we have to be okay working through some of it. So what we're
mm.
finding is usually if we can get that soft cone where it's not that firm, it's probably just fine. And it's probably a good thing to start pushing into. And some people have to. So I think there's some flexibility with some people. Some people you can get around not coning at all, but thinking about the difference that, hey, like coning's not the end of the world. And it's just a sign we're not managing our pressure well.
So good. And like you said, there's not like research around whether or not, okay, working through that coning is going to make it worse or not. And like it sounds like benefits outweigh, if there are any risks, benefits of regaining the strength and working through it. It's more beneficial.
Absolutely. And it's
Yeah.
interesting because the exercises that we're usually told not to do, like planking and sit-ups and things like that, I think they probably started off with good intention, like, hey, these are the positions that people cone the most with. But it's actually interesting because what they're finding in the research for diastasis and like actually helping heal the core, those are the exercises that help approximate or bring rectus back together. So
Mhm.
we're avoiding exercises that are probably better for us. So again, I guess here's my answer. Keep it strong. Like, don't stop using your core, and honestly, keeping your core as strong as you can and long as you can through pregnancy is the best thing you can do.
So good. So good. And yeah, I had never heard that before because like that, and that made sense to me because you and I, our conversation was around pull-ups. And anyone who has followed along on social media knows I was very sad when I got to the point where I started to see the coning in the mirror when I was doing my pull-ups. And I love pull-ups. I love back day. Like it's my favorite. And I'm like, no, when I started to see that. I think it was like around week 21 or 22, something in there. Because otherwise I was like whipping them out up until then. And I was like, oh, all of a sudden we're coning now. Okay. But you and I talked about hard versus soft and just like how naturally your abdominal muscles are separating. So you might have some coning, but it could be soft. Or is it
Mhm.
hard and there's you can see a lot of pressure, coming through there. And then we even talked again about the individualization. You and I talked some about like, okay, maybe how I modify things or do some but not as much volume or whatever. But like it wasn't just a whole, hard and cold like quit your pull-ups,
Yes,
discussion.
never black and white. Never black and white. There's always that gray area of, you know what? Like we don't know, let's work through this together. And I think people try to make it black and white to make it easier. And then I think it just
Yeah.
makes things more fearful for people. People become very fearful of black and white, and it's not black and white.
Yeah. Yeah. Well, that's I just appreciate so much you guys and like just taking the time to get to know your patient and know where she or he is starting out at. But and that's, even just some of the recommendation I got from one doctor, while pregnant was like the classic, don't lift over 30 pounds. And then I'm like, well, this is what I was doing before. And then they're like, oh, well, you can, I mean, just so you don't have to worry about it, you could just not lift more than 30 pounds, but you could do more than that. But I was like, so we never had that conversation initially until I kind of, you know, pushed back on
Brought
it a
it
little bit.
up.
But so appreciate the individualization so much.
Yeah, and it should be. And you'll hear that from doctors, oh, well, I guess you're okay if you don't. Even the research now is supporting, even if you weren't working out before pregnancy, like working out and getting active is still a very positive thing. And the whole don't lift over 30 pounds. I'm sorry, I can't help myself right now. There is no research on that. Like, why? There's I could go on for hours and hours about all those myths. There is no research. The 30 pounds like is ridiculous. And most people who are having a second kid, like you're
They're,
going to be lifting 30 pounds. Like, why don't we prepare women to lift 30 pounds? Why do we say
yeah.
stop lifting? And then all of a sudden now you lost your strength. You have a newborn, you're lifting a stroller and bags, and like now your body's not prepared to lift 30 pounds. Like, oh, sorry, that I'll be done, but
No, I'm so right there with you. I'm like, yes, keep going. It's fine. Oh, it's so good. Yeah, it's like, man, just preparing yourself for the most strenuous time of your life. That would be a good idea. Yeah.
Yeah, might help. I don't know.
Yeah, it might help. So good. Thank you so much for this conversation. We touched on a lot of really great topics. Is there anything else that you would leave everyone with as far as pelvic floor health or anything at all that we didn't touch on?
I think one of the big things that I like to tell people is you're not alone. I
Uh,
have so many people that feel broken or damaged.
mm,
There's a lot of people that are out there going through it, and
yep.
just know that there is help. There are a lot of different people that are now specializing in pelvic health, and just know that you're not alone. There's a lot of people that are going through it, and you're not broken. Your body was meant to have a baby, it was meant to go through these things.
Mm.
Just know that there's support and people out there that can help.
Oh, so good. Because I think that these are topics that can be taboo or like people don't want to talk about, but you're like, so many women are struggling with the same thing
Yes,
as
we just
you.
don't talk about
We just
it.
don't want to talk about it. Yeah. And it's
No.
so, so good. And guys, I cannot recommend a pelvic floor therapist enough. And specifically Dr. Kelsey, if you are in the Utah, like St. George area, go see her at Shift. But like even as someone in the fitness space and like someone who's pretty in tune with their body, I got so much value even out of our first visit and I can't wait for future visits. So definitely, definitely go do that. And thank you so much for your time. Where can everyone find you? What's the best way to reach you guys?
So you can on social media on Instagram, you can reach me at doc period Kels Kels, or on our website at www.shiftphysicaltherapy.com.
Perfect. Okay, I will put that in the show notes too, so everyone can easily access that for you guys. But Dr. Kelsey, thank you for your time today. I really appreciate it.
Thank you. I've had so much fun today.
Yay, me too.